Hello, healthy friends. I'm Dr. Maria. Today we'll discuss one of the most common abnormal pregnancies in Asia, Hydatidiform mole, or what some call a molar pregnancy. You've probably heard this term before, but don't fully understand it. What exactly is a Hydatidiform mole? What are the symptoms and how is it treated? Let's discuss it in detail to help us become more aware. A Hydatidiform mole is an abnormal pregnancy in which the tissue that should form the placenta grows abnormally, forming fluid-filled bubbles resembling grapes. Unlike a normal pregnancy that results in a healthy fetus and placenta, in a molar, the fetus doesn't develop properly, or doesn't develop at all. This mole belongs to a group of diseases called gestational trophoblastic disease. There are two main types: complete mole, no fetus is present. The entire placental tissue turns into a bubble. This usually occurs when an empty egg is fertilized by sperm, so the genetic material is solely from the father. As a result, the growth is completely abnormal. Partial mole, a fetus is present, but it is not developing normally. This is usually caused by the egg being fertilized by two sperms simultaneously, resulting in 3 sets of chromosomes triploid. The fetus usually dies early in pregnancy while the mole tissue continues to grow. Signs of a Hydatidiform mole often appear early in pregnancy, usually in the first trimester. Some typical symptoms: vaginal bleeding. This can be spotting or heavy bleeding. Excessive nausea and vomiting, much more severe than in a normal pregnancy, hyperemesis gravidarum. Uterus larger than gestational age. When examined, the uterus appears larger. No fetal heartbeat can be heard even though the pregnancy is full term. Grape-like tissue is passed from the vagina, sometimes accompanied by high blood pressure or signs of preeclampsia in early pregnancy. These symptoms should be checked immediately, as a mole can develop rapidly and be dangerous. To confirm the diagnosis, doctors usually perform pregnancy ultrasound. The typical appearance is called a snowstorm appearance, where the uterus appears covered in white dots resembling a snowstorm. HCG blood test. Pregnancy hormone levels are usually very high, far above those of a normal pregnancy. Tissue examination after evacuation. The mole tissue is examined in the laboratory for confirmation. Early diagnosis is crucial so that patients can be treated quickly before complications occur. A mole is not only a failed pregnancy, but can also cause serious complications, severe bleeding when the tissue ruptures. Persistent trophoblastic gives mole tissue continues to grow even after curettage. Choriocarcinoma gives a rare form of malignant cancer that can arise from a mole. Temporary fertility problems occur as the uterus must be monitored after evacuation. Fortunately, if treated promptly, almost all cases can recover well. Molar tissue evacuation performed with suction curettage or vacuum aspiration. This procedure removes the abnormal tissue from the uterus. HCG monitoring. After the procedure, HCG hormone levels are checked regularly every week until they return to normal. Monitoring continues monthly for 6 to 12 months. Temporary contraception patients are advised to delay pregnancy for about a year so that HCG levels can be clearly monitored without the bias of a new pregnancy. Chemotherapy, if necessary. If HCG remains high or the mole tissue becomes malignant, the doctor may prescribe chemotherapy drugs. Friends, a Hydatidiform mole or molar pregnancy is not a normal pregnancy. While it may sound scary, don't worry. With a prompt diagnosis and appropriate treatment, most patients can recover completely and even go on to have a normal pregnancy in the future. The important message is, don't ignore abnormal bleeding during pregnancy. See your obstetrician immediately if you have any concerns. Follow the recommendations for HCG monitoring and regular checkups after the curettage. Doctor, presenter's name. Thank you for listening. I hope this educational video has broadened your knowledge and served as a reminder of the importance of maintaining a healthy pregnancy from the beginning. See you in the next health education video. Stay healthy and love yourself.